Addiction is a disease that fools you into thinking it's a need, and overcoming it can be a painful process. But there is help. Here to tell us about a new type of treatment is Keri Stitt, President and CEO of Youth180, and Dr. Kleinschmidt with UT Southwestern Medical Center. Welcome to both of you. Thank you very much.
Thank you.
Keri, let's go ahead and start with you. Tell us about Youth180. What exactly is it that you do, and how do you help the community?
Yeah, Youth180 is an innovative thought leader helping youth and their families navigate social and environmental challenges through prevention, intervention, and clinical programming. We do that for free across 4 different counties within Dallas, Dallas, Hunt, Rockwall, and Kaufman counties.
All right, so Doctor, I understand that Youth180 is now using medication-assisted treatment. Tell us exactly what that is, how it works.
Yeah, medicines are a very important part of the treatment of opioid addiction. The medicines are buprenorphine and methadone, and a very important thing that happens a lot is people ask, why use these drugs? Aren't you just trading out one drug for another?
Right.
And it's very important to understand, no, that is not the case. These are treatments for the disease of addiction. When you have addiction, the brain disease, it results in cravings and desires to use that are very powerful. So powerful, you do what you got to do in order to use, which includes many bad behaviors. And when you do bad behaviors, your life gets messed up.
Right.
So what these medicines do is they treat the disease of addiction to help you return to normal life. And there's nothing that does a better job than that, than the medicines. However, other support services are also very important.
Right, so it basically cuts out the craving. It makes it to where you don't feel that need anymore, that your body is tricking you into thinking that you have to have this.
Yes, and the patients who do well on the meds, they're like, wow, why did I not start this before?
And it's shortened it. I'm going to shorten it if you guys don't mind. MAT, is that what you guys call it? Okay, good. That's a mouthful to say. Medication-addicted treatment or assisted treatment. So why is that so important right now, especially to your organization, Youth180?
Yeah, young people, we're seeing a lot of increase in young people turning to opioids to cope with anxiety, depression, untreated symptoms of trauma, if you will. And so having the ability to start somebody on medication-assisted treatment helps us to be able to eliminate those cravings and desires and dreams to use, while we can also give them skills to help them cope with some of the things that they're feeling, which is why many people use in the first place.
Right. And I'll be honest, because usually when I think of addicts, I tend to think of older people or people well into their 20s, 30s, 40s. I don't generally think of young people, but I know it absolutely is the case. And I think I have to wonder, because mental health is on everyone's, the tip of everyone's brains lately, how does that play into recovery, and does Matt address that connection too, Doctor?
Yeah, a great question in terms that often patients start their use because of mental health issues.
Right.
So in terms of helping their addiction disease, helping them with the mental health is very important. And so when it comes to adolescence, something as simple as anxiety or just life circumstances are enough to help these folks head in an unfortunate direction. And so the mental health piece is a very important part of this whole care package.
And very quickly, can you tell us, for folks who want to know where that they can get more information about Youth180 and how they can get involved?
Yeah, you can visit our website, www.youth180tx.org.